Greetings, Dr. Mark Winton here from the Department of Criminal Justice at the University of Central Florida. And in this video, I'd like to spend a little bit of time talking about heroin policies. I'm going to talk about an article that was published 20 years ago that I talked about in a podcast at least 10 years ago. And you might ask, well, why are you going back 20 years? And my reason is because what was recommended 20 years ago, we're seeing implemented today. So it took a long time. And we can think about, the politics, the debates, and, why it took so long for this policy to be enacted. Anyway, I'm going to base this discussion on an article by Johnson, Mayer, and Friedman published in 2001 titled What Public Policies Affect Heroin Users, published in the Journal of Applied Sociology, Volume 18, pages 14 to 49. So, great article, and one that does a comparative analysis. And the authors looked at similar and different policies related to heroin and health and poverty reduction in New York City and Sydney, Australia. So New York City and Sydney, Australia. And they focused on how these policies influence behaviors, lifestyles, and the outcomes or consequences of heroin users in these two cities. It's based on an intensive longitudinal ethnographic study. So they interviewed and followed small samples that they tried to match for similarities in New York City and in Sydney. So they had 16 in each group. So while it's a small sample by quantitative survey research standards, they were able to use a small sample to obtain great rich detail about a variety of factors and variables and concerns. So this is a very helpful and useful policy study, although we may not be able to generalize beyond the groups that were studied. So, I don't know if things would look the same in Orlando, Florida, especially with the big time change, or, in Los Angeles, California. And so I think they provide an excellent model that can be followed for greater comparative analysis. So looking at the policies and outcomes, comparing New York City to Sydney, they found that in New York City, they were slow to implement needle exchange programs, while in Sydney, needle exchange programs were in place. And here, what's going on is that the organizations in needle exchange programs exchange the drug users different needles or syringes for clean ones, and they may also offer some counseling and referrals to other healthcare agencies and the like. But the main thing there is they're looking at decreasing diseases that are transmitted from sharing needles, and so that was one of the main goals there. In New York City, it was more difficult to get clean needles, but easier in Sydney. There was also tougher criminal justice policies related to arrest and prosecution in New York City, while in Sydney, there was more of an emphasis on harm reduction policies. In New York City, there was no national income or health no national income support or health insurance, national health insurance, while in Sydney there was on both income and health. They found in New York City that they had a high HIV/AIDS death rate, and in Sydney a low HIV/AIDS death rate. They also found that there were higher healthcare costs in New York City compared to Sydney, and higher needle sharing in New York City compared to Sydney. Also, they found greater social exclusion in New York City and a higher rate of homelessness. So they found that there indeed were some big differences based on the policies. And so we can see that the needle exchange was one component, but also access to health care, reduction of poverty and homelessness was also utilized. And Sydney had much better outcomes. In fact, that a large number of the participants in New York City had died during the study. They also point out that there can be policy conflicts between agencies. And as I mentioned before in another video, that you may have turf battles going on, that there's often the debate, what should the focus be? Criminal justice law enforcement or treatment and prevention? And there's only so much funding. How should that be distributed? They also found that there tended to be low levels of drug treatment programs available. And they also found that methadone treatment lowered heroin use and also drug-related crime in both settings in New York City and in Sydney. So methadone treatment worked. Although in both cities, heroin users continued to use heroin, so that still remained a problem. And they also saw that there was stigmatization going on in both communities, and also a widening geographical space between law enforcement and public health, which again is that debate. And so we can learn a lot by studying this. Okay, as I mentioned, I basically presented this in a podcast, maybe 10 years ago. This article that's 20 years old. Why do I bring this up? Well, the reason is just this year we have opened a needle exchange program in the county where I live. And last year they passed a policy allowing it, and then this year my understanding is that it's opened up. And they do several things there. Needle exchange, obviously, but also counseling, safer practices for injections. And they also provide Narcan, which can reduce, or reverse rather, heroin overdoses. So Narcan's actually a lifesaver. And so they, will provide that as well. So it'll be interesting to see maybe a year, 2, 3 years down, when we look at that program and look at, have we seen some, reduction in a whole bunch of different problems, we can see, how it worked. I'm hoping that we see reduction of transmission of infectious diseases through needle sharing, dirty needles, and also we see an increase in treatment, and also a decrease in overdoses, and a decrease in deaths and other health-related issues. So there's a whole bunch of different things we can look at, and that actually would be a prime setting to do an ethnographic study, just like Johnson, Mayer, and Friedman did. You're talking about 20 years later in a totally different environment. That would be a fascinating study for someone to do. So hopefully someone's going to do it. I'm not, but hopefully some criminal justice sociologist, psychologist, or team, and that they're collecting data, and we'll see that, 6 months, year, 2, 3 years out. And so here we have to think about how important it is to have rapid response to problems. I was very frustrated when I started talking about the heroin problem I was predicting we'd see, and looking at some of the projections and everything. We need to do something now. We're talking about, 10 years ago already. We need to do something now. And to see just the tragedies that have occurred, I'm always thinking, could have we prevented, some of those? And how are we able to bring in the research, work with multidisciplinary teams, work with the treatment and prevention providers, work with law enforcement and the criminal justice system and the courts and corrections, and actually have better outcomes for the individual heroin user means better outcomes for society. And this wraps up this video. Thank you.